My appointment with the sports medicine doctor the second time was a success. Well, it was as good as could have been hoped for, or as good as could have been expected, or as good as could have been desired. I mean, the problem is when you have these high expectations, like you think you're meeting Dr. House, or you're going to diagnose all your issues right away, and you've seen other doctors already, you gotta just sort of disabuse yourself of those ideas, shall we say. That idea that this doctor is going to fix you. This doctor is going to... the main goal is, like I was talking to my friend, is moving a step forward each and every day, right? You got to have realistic goals of what your doctor should do for you. What are you going to get out of this appointment? Now, the thing is, when I went to see the sports medicine doctor, I planned a lot. And I was thinking, what do I want? And it really crystallized a few days afterwards when I was thinking, was this a good or a bad visit? So first of all, the doctor was thorough. I like that. He did a very thorough exam. That didn't have much to do with me in preparation, because I couldn't have prepared or anticipated or even realized that the most important thing for a doctor being thorough is having somebody watch them. Not me, but having a student watch them. Or a resident. Because when you're teaching someone, you gotta make sure you show them how it's done, right? It's like when, say I'm working with my dad and he doesn't really want to do this last part. It's simple, he's done it before, he just putting it off, right? I said, why don't you show me how to do it? And we can do it together. He's like, oh, that sounds good, right? All of a sudden, he wants to do it. So the thing is, this doctor, I don't know if he's normally that thorough, but with this student watching, he was very thorough, examining all my legs, having me, lie down on the exam table, having me stand up, having me do some, stretches, blah, blah, blah. The second thing is, he answered questions in a way I felt was actually appropriate, saying, I don't know. Because I was asking about shoes, some people like padded shoes, some people like less padded shoes, what is better? Because there's always people who do barefoot stuff nowadays, and I'm saying, that's better for you. I don't know. He said, we don't know, which I found is a valid answer. I said, is there any evidence, studies? He's like, I don't think we know. But the conclusion, or the takeaway point is that he ordered physical therapy for me and an MRI of my leg. He thinks it's likely nothing. He did comment what is wrong, right? It's tighter and it's weaker. But, right, he thinks most likely there's nothing. But if there's atrophy on the MRI, that is significant. That would mean something. And we probably should investigate further. So, in that sense, I think it's a good, successful visit. Because he's actually doing something about it. He explained to me his thought process. And even though he's pretty certain it's fine, he's not absolutely certain, so let's just make sure with that MRI. I mean, he's a sports medicine doctor. He's not an orthopedic surgeon. He's trained to look at people with musculoskeletal disorders, not to do surgery. And I don't think there's any reason I need surgery. I don't even know what surgery would do. So I think it was as good as could have been hoped for. It was a successful visit. I think one lesson I learned is redefining the idea of success, right? And it's funny coming from a patient's perspective versus being a doctor on their side. Well, I guess I always thought it's funny how patients expect to get better right away. And I tell them, if you've been having this for months, I don't know that I could make you better right away. If you had it for a day or two, maybe, but if you've had it for months, not like I'm going to fix it right away. I've had this for weeks, if not months. Why do I think I'm going to get it fixed right away? But at least getting started on the path of investigating, improving things, that's good. A perfect visit.